Greenafrique.
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 Greenafrique. My name is Ami Diop, a 6th-year medical student. I live in Sukuta Health. So we are here today to do health screening for diabetes and hypertension. So far we screened about 70 patients. So among those 70 patients, we have seen that some have high BP. So we advise them, give dietary advice and some of the risk factors to prevent hypertension and diabetes. I want to thank Greenafrique for this wonderful initiative, reaching out to the Sukuta Health Centre and also UniGamsa for being part of this wonderful initiative.
I am Babukar Jata, a 4th-year medical student from the University of the Gambia. And here we are at Sukuta Health Centre to help Greenafrique organization in a screening exercise of diabetes and hypertension. Since we know diabetes and hypertension are the most prevalent non-communicable diseases in our communities. So we are here to screen ages across like elderly, middle-aged and young ones on diabetes. So it is important to do this screening to know how many people are affected, because many people have these conditions and they don't know about them, and many people think they are curable whilst they are just managing. So we're just here to do the screening and give health advices to them in how to manage their blood pressures and their blood sugars. Basically, that's what we're here for.
So we will check in for the BP and for the blood pressure also. So first, when the patients come in, we first take their vitals and their information, and then they're taken to ask questions, their age and where they live. So then we also check their BP. So how this is done is, first, when they come, we have a machine that we use to check the BP. So first, the normal BP is supposed to be 120 and 80. So that means the systolic being the highest, it should be at 120. Diastolic being the low, it should be at 80. So that's the normal range. But then we see that some of these patients have higher BPs than normal. So then we have our doctor here who consults them. We also check for their BM. So the BM, normally we check for fasting and random. Fasting being that the person have not eaten the whole day, maybe since morning until the person is coming here. He has not eaten, he or she has not eaten. So the fasting normally it should be around 3.5 to 5.5. So if they come, we ask them if they have eaten anything since morning or they have not. So if they have not eaten, we make sure that we check if the range is around 3.5 to 5.5. So if it's above that, we advise them. So because we cannot just rule out that the person is diabetic right now. But what we can do is maybe ask the patient to revisit the hospital and see if the BM is still the same, if the blood sugar has not reduced or it's still the same. They have to do series of tests to confirm this. So we also do the random. That means that if they have eaten maybe, or we don't know if the person has eaten or not, we also check their BM by using values to compare this with the recent value that we have taken from them. And also we cannot just diagnose them with diabetes right now, but then they can go back to the hospital, maybe change their diet to try and regulate their blood sugar.
So basically, once you come, it was actually free for everybody in the community, not only those in the hospital. So others outside are invited. So basically, once you come here, you take your biodata. That is your personal information, including your name, age, address, the complaint you come with, and your social history. So the name is actually for the identification. Then the age,
is partly a risk factor for diabetes and hypertension. So diabetes and hypertension, you can develop it while getting old. Some do have it when they're young, but age is a risk factor. The older you get, the more you're closer to developing hypertension. So the address, yes, is also important. The risk factor, smoking is one of them. Once you smoke, you are exposed. You are high likely to develop hypertension because it actually destroys your blood vessels. And in the Gambia, we have seen that it's increasing, both in adults and in young ones. It has a lot of side effects. You have your kidneys, your liver, everything, your heart. So let's protect ourselves. Let's see how we eat. Let's exercise.
Assalamualaikum askan bi ñu leen nuyu ku nekk ci turam ak santam maa ngi tudd Aïssa Dias may jógee ci wàllum jàngukaay docteur yi University of the Gambia Medical Students Association tey nag maa jiite mbootaay bi mi University of the Gambia Medical Students Central Minister bi di saytu ci wàllum wér tey ñu ngi ànd ak Greenafrique ñoo xam ne association bu ees la ñoom tey ñu ngi invite fii pour ñëw ñu saytu askan bi seen wér-gu-yaram so tey bu ñëwee gis nañ ne tegal leen mag ak ndaw xale yëpp cek nañ seen blood pressure bi dee wax tension cek nañ tamit seen sukar bi muy feebari sukar bi parce que askan bi ñëpp xam nañ ne tay fan yi feebari sukar bi ak muy diabète bi ak diabète ak hypertension bi bari na trop te bu njëkk dañ daan gis ne xale yi ñu ko daan am waaye léegi gis nañ ne xale bu njëkk daal dañ daan gis ne mag yaa ko daan am waaye léegi gis nañ ne xale yi la gën a fës so moo taxoon tey Greenafrique ñoom tamit def ànd ak seen mbootaay ànd ak ñun di xale medical students yi pour ñëw ñu saytu askan yi Sukuta bi fii nii ñu ngi fii si Sukuta Health Centre bi so bu ñëwee tey check neen around almost 20 nit muy ñaar fukki xale Sukuta fii nii mag ak xale ñëpp gis nañ leen so bu njëkk a gaay bu ñëwee dañ njëkk a jël seen lu ñu wax history soo ko déggee mooy comme ni nit ki fu mu cosaanoo ñu ñëwee daal léegi la ca neen tur bi la ca neen seen at bi parce que xam nañ ne feebar bi di hypertension ak diabetes dañ ko di ooyee non communicable disease non communicable nag soo ko déggee mooy disease feebar yoo xam ne nit ki dina ko mën a am nekkul ne danga koy waale si ay lu ñuy wax bodily fluid mooy ay ndox wala leneen jumtukaay so léegi gis nañ ne WHO mi mbootaayu wér-gu-yaram bi seetlu nañ ne noonu lu ñuy wax non communicable disease léegi bari na trop mu ngi ëpp doole lu ñuy wax communicable disease so moo tax Greenafrique ñu gis ko ne dafa important pour ñoom tam ñu dimbale askan bi tey ñu ngi digale ñu ngi fii si Sukuta Health Centre dafa mel ni tey docteur yaa ñëw si Sukuta pour saytu seen wér-gu-yaram bi so check neen seen blood pressure bi mais tension bi gis neen yeneen maire yi ak xale yi seen buñ cegee seen pressure bi am na ñu éeg am na ñu wàcc digga la Gambie fii dañ dee wax ne am na ñoo xam ne dañuy dox ak pressure bu éeg lu dee waral lu bari seen dee gaaw yi mooy nag dangay gis nit ki tey nga gis ko si ngoon si nga gis ne diw dee na lu ko rey fekk pressure baa éeg so moo tax Greenafrique ñoom tam ñu gis ne dafa baax pour ñoom tam ñu dimbale askan bi saytu seen wér-gu-yaram parce que xam ne fu mu nekk nii jamono métti na wér-gu-yaram bi métti na léegi soo waree dem si lopitaan bi ñooy war a check dafay seet te askan bi gis nañ ne jumtukaay bi métti na daal moo tax ñoom tam ñu gis ne is important pour ñu ñëw dimbale askan bi soo cegal neen seen pressure bi am nañ si docteur boo xam ne moo leen naa seet suñu xoolee ne sa pressure bi éeg na dinañ la yóbbu si docteur bi pour mu xool la def la war a advice parce que gis nañ ne Gambie fii ñun suñu jumtuwaay yëpp diw bi baax so moo tax ñu yóbbu ko si docteur bi pour dangay gis ne mun lay expliquer loo war a lekka su dee diw bi nga wàññi ko dëgg la Gambie fii nii soo xoolee baadoola yaa ko soo suñu waree wax nit ki ne bàyyil diwlin dafay lor nit ki waaye dinañ wax ne pour nga wàññi diw bi ndax diw bi gis nañ ne daf di yokk tension bi ak diabetes te diabetes dafa nekk loo xam ne feebar boo xam ne ñu dee wax silence killer la daf la day rey si romb soo gisee mu manifeste rek mu wane boppam rek xamal ne fekk rey na la bu yàgg so moo tax ñu ngi ñaan askan bi ngir yàlla fu ngeen mun di nekk dee leen di dem si lopitaan bi ñu leen naa xool ngeen xool seen wér-gu-yaram amul jëpp te su ngeen toogee tam xaar ba mu leen ëppa doole mën na la naa rey te loolu baaxul si askan bi baaxul si ndaw yi baaxul si dëkk bi so ñu leen naa ñaan ñu xale medical student yi tey ànd ak fii di Gambie Greenafrique ñu leen naa ñaan ngeen dem di def wér-gu-yaram di seetu seen yaram bi
dole na dara jam dal medical student ni no ni yar ken yakatan da jam ko ko ta university to binde mbale sugura janne anu mi en si jam wala
kana pour que mo le jar kende yal ka des ka jibe ba ko ndi mo le bana ya ka mi Greenafrique so na re mi na bi wala ka mo li yelo ka jibe fasale da fa jida ko wala ka ka ni ya ni no sikuru ko ka ni ya ba wo yele selo ani sugu kuro mi da ka moy ba to wari gambe ya ito musa ga ko ni na sa sa ji mi alon ko mo ga jo sa ni no ada ka mi ko ito ne sa la ko mi ko ise mo wara gambe ya ni mi ko la de so nga yelo jibe na asaka da ni ka ran mi ko le ko ni sa na no yelo sa mo no ai ba jaro lo tije ata jaro no mi sa da mi ka ja bara ka manage sugo ko na go ya so ni na running sanjo nyen ka kalon de bawo sanjo kana ka dita ni sanjo seleta ko alfa ni ajibe ita la yelo no makra da ni tol fani ga yelo no makra da bawo no bal go nyoto ni ko ko do ni ke ba kana so wala na sanjo fana nyen ka na woto fana den sene nyen ka ku do le nga ko kumara ila umuntu wale do moro ke ila fo do moro ke sa kana ni do moro ka me nyada ila su ko nyada sele den sana lo ba ta re so ndola jambo le jawo kama la ntol be jamoro mi kero le be dando mi kero bo dini ke am so ko mbelo ko mo belo boda so mo isa kata no wati ni wadi kata baji welo tano ke yelo ni ke su ko de fasi da baji
komin hiddamon hat so wonani mon do hande min mido ummi UniGamsa so ko be yimbe ummi be Greenafrique wadi men invite do hande ko Sukuta Health Centre so hande men arno do fi darugol yimbe ben parce que sa ndari yimbe ben be woni do wobbe ne hebi hypertension wobbe ne hebi diabetes ko be anda so minen non me wi hande yumen aru men dari be anda ben ben nawni tabe anda wala be anda ben nawni be wonno hettude lekki tabe wonanta di hettude so men hebi do be anda ko be student wobbe anda non ko be anda ko be ay doctorat so sa yi henno kadude non do nawnare witen en hypertension diabetes ko wondo nawnare mo anda joni san nare ko der lady men yimbe hewbe na wonde hypertension en diabetes ko ni be andata wobbe na non be andi ko non be wonani de lekki so hande men arno fi men dare yimbe ben so men imo anda hada wonde nawna den men yi heto ma ko hodum fodda wadude hodum woni piji di anda ko tan nyamude e so woni kadi ada foti hettude lekki tadi men yi heto ma ko hombo lekki fodda hettude men na andi wonde on hebata time e fi hogol ko hospital to fi darugol handu mon so ko dum wadi men kadi men wi men yehu men tata ko der heydito men dari yimbe ben be anduda ben benan nawni so ko mi way wadde just conclude with woni sa andi hada wonde mawdoma mo anda naw wonde den nawnare weekend hypertension wala diabetes is essential ankadi hiddo mabbe yehon ko hôpital natino do date dum ko nawnare mo anduda so foni ko fami comme wiyen so woni nene wala baba no dum hebi hiddo ben to kambe tadi be wayi hebude nawnare de so ko nawnande anda nyawde take why is manageable so hetti lekki e dum don fo it's manageable.
Good afternoon, my name is Dr. Foday. I'm a medical doctor working at Edward Francis North Teaching Hospital, and I'm also a member of this organization, Greenafrique organization, situated here in the Gambia, main center in Sukuta. Today we have our screening session here in the Sukuta Health Centre on diabetes and hypertension, and this is our second successful event that we organized. Previously, about last month, we organized breast cancer screening, more of breast cancer awareness on Zoom, and today we have our screening on diabetes and hypertension. And we've successfully screened about 19 patients, all of them, some are hypertensive, none was found to be diabetic, And we can be proud and say that this is one of the most important initiatives that we could have in our own society. We are in the beginnings of Sukuta, and coming up with such initiatives to help the society screen those who are hypertensive and also give them the necessary treatments is a key factor in developing our primary health care in the country. So we advise them on the proper diet and also the proper physical activities that will help them to keep their blood pressure at optimum levels, and also to give them general health advice. We also saw some patients in our outpatient department and give them the necessary assessment and also the necessary treatment that they need. So I'm a member of Sukuta and I'm happy to be part of this great initiative.
Good afternoon, everyone. I'm Kathleen Budeng, and I am the Advocacy and Outreach Officer of Greenafrique. And today we come out once again outside to do more screening on hypertension and diabetes that have been a cause of concern over the years here in the country, because there is no age gap as to who is having diabetes or who is having hypertension here in the Gambia. We've seen kids having diabetes, we've seen kids having hypertension, so it's a major cause of concern and it's a major public health awareness that I believe we should come out as youth to work in such a cause. So we organize an outreach here in Sukuta, because they say charity begins at home, so before starting outside, we do it here. So we came to the hospital to talk to the management and successfully got approval to use the hospital space. And so when you talk about hypertension, it's more like a increase in blood pressure beyond the normal range, or my lecturer would say is 2 standard deviations of. So it's a really major cause of concern, because the complications of hypertension are things that are so unbearable, like stroke. It's something we see every day, someone suffering from stroke. Daily you see a stroke patient, someone is paralyzed because of stroke. And when you look at it, it all stems down to our lifestyle. We need to modify our lifestyle the way we live. What we eat is really important, because as the saying goes, we are what we eat. So things like salt, all this seasoning, different seasonings, we need to be aware of it. We need to be aware of sedentary lifestyle, that we staying at one particular place without moving. It's really such a bad thing that you sit at one place thinking that that's the best for you, and you're thinking that that's high life, but it's totally wrong. And also, junk food is becoming so much cause of concern. People are eating a lot of junk food in the Gambia, and we are not exercising. Exercising is not about reducing your body weight, it's more than that. It has to do with your health. The more you exercise, the more healthy you are, and the more you live in good shape. So the youth, we are losing much of that. Every time we want to go to restaurants, you want to eat, but you don't want to do the necessary work to burn down those calories. So that's why it is really important that we check our surroundings, we know what we're eating, we modify our lifestyle, because things most of the risks are modifiable risks. Things like your gender, your ethnicity, and also we cannot modify that, but things like what you eat, your lifestyle, whether it is sedentary, whether you're eating it, we can modify that. So modifiable risks is something that we can work on. So that's why we came out here today to work on a screening, to help people know their status. And also thank God we have a doctor here that came up with us today to do the consultation, to advise patients, because it's better to prevent a particular illness than to cure it. Curing takes a lot of time, so it's better we prevent a particular state. So that's why we came here today. So it's more like we're working on the preventive medicine side, more into public health. And also when you look at diabetes, we can have something like juvenile diabetes, so you see young kids, very, very young, having uncontrolled blood sugar level. They have a lot of excessive glucose. So that is really hard to control, because they're kids, they're bound to have desires. So it's really so hard. So that's why we have to work on adults to be able to sensitize them, let them know what the diabetes is all about. It's one thing having it and it's another thing preventing it. So the prevention is more important than the curing. But now once you're inside, what are some of the things that you do? You need to modify your lifestyle. For diabetes patient, I always advise having a sugar machine where whatever you eat, you got to check your blood sugar and see how much of the blood sugar spike you have. If you know that it is more than the normal excessive, then you need to stay away from that. So all this step down to lifestyle modification. You need to modify your lifestyle. You need to stay to start. It is very important to screen yourself. You never know when you would find out something is wrong with you. So screen yourself, visit the doctors regularly, stop taking herbal concoctions because those are things that they stop us here in this country. You have diabetes, you run and take guava leaf or something else. So once you see something in your body that is not normal, the first thing you need to do is to go to healthcare personnel. They went to school to learn about the human body for a reason. So the first thing you need to do is go to healthcare personnel. You see something in your body that it's not normal, and then they will find ways to help you. But you cannot start the other way around, going to taking herbal concoctions. Before you know it, it's already too late. Things like diabetes. We have a lot of amputees here in the Gambia. They amputate their leg because the healing process in diabetes is very slow. Once you have diabetes, that's a pathology. Your normal physiology is already off. You have it takes a long period of time for you to heal. So my advice to everyone is, please take care of yourself. Visit the healthcare facility when necessary. Stop listening to our home doctors and stop taking home remedies because you never know where this complication will lead you. So we have plans of doing more of these outreaches, trying to reach so many places in the Gambia, even the remote areas, to make sure that we spread the message, sensitizing them about these common non-communicable diseases that we can help prevent. So long as we have support, we have the financial capacity, we have the human resources, we're willing to go beyond Combos to other remote areas, advise them and help them out. So also we would like to say a big thank you to UniGamsa. It was actually helpful that they came here to help us. They came with their own resources. It's really great for them to come out, and I would like to thank the president more especially John Johnson because I reached out to him very shortly and he was able to mobilize a lot of to the health minister to come here to have some impact here in the community, which is actually great. And from them, they are willing to raise other occasions that we have. So a big thank you to UniGamsa. We appreciate it, and we would love to have more partnership with you as well. So like I said earlier, you have to eat healthy. You have to be mindful of what we eat. We are what we eat, so eat whatever you know that it's not going to harm you, you have to eat it. Stop taking advice from our home doctors. Please, they did not go to school to learn the human anatomy and physiology. You need to know how the human body works before you can prescribe someone something to drink, okay? So please, whenever you see something in your body that is not normal, rush to the hospital. These people are in the hospital for a reason. They learn, they know how your body works. They'll be able to help you. So do that before you go to our home doctors as well, and also Dr. Goodman. Let's do that and stay hydrated. Drink a lot of water. It's important to stay hydrated, as well as exercise. It's not only for people that are obese. Exercise is for everyone. For us to stay in shape and also be in good health, we need to be involved in a lot of exercise, even as small as walking. Brisk walking is really good. There are some people, they cannot walk, they cannot run, they cannot jog. So you can do brisk walking for 30 minutes and coming back. So long as you sweat, it's good for you. Even to the hypertensive and diabetes patient as well. You can do a lot of exercise without necessarily walking, jogging. Just do the minimum you can, as simple as working. If you are someone that is already you're an amputee now, you can do the minimum that you think will make you sweat. It's all important. It's better than staying at one place. So that is my advice to everyone. Let us support this cause. We see outreaches, be there. Try to know your status, it is important. So we are always saying prevention is better than cure, so let's endeavor to always work in the preventive medicine and not the cure. Thank you everyone, and also thank you for Greenafrique, to every other person that leave each and their engagement to come here to do this and make sure we have a successful outreach. We hope to see you next time in another different event where we can touch life in a positive way. Thank you so much.
Thank you very much.
Thank you.
So on Jara.